Over the past few months, much has been said about the impact of COVID-19 on the healthcare industry. The first wave of lockdowns ushered in a quick transition to telehealth, forcing patients and healthcare providers to interact at a distance, mostly via digital channels. And that was everything from Zoom meetings to WhatsApp chats. And for pharma companies, that also meant face to face meetings were a no go. And while it's too early to predict what the new normal will look like in terms of healthcare appointments and consults, will that be in person, online, or some sort of hybrid situation? It's clear that there are immediate implications for pharma marketers today. So, what can we learn from the patient experience with telehealth? And what does that mean for the future of digital strategies? Our healthcare team recently conducted some research to help our clients tackle these complicated questions. Today, I'm talking to Yannicka and Johan about this research. They both work with a broad range of pharma companies and medical device providers in EMEA and in the US, respectively. So, Johan, can you start off by telling us a little bit about the context in which we set out to learn about patient experiences?
Sure, Nicole. So, all of the shift to digital was very sort of abrupt due to the global pandemic. It wasn't necessarily something new. So, telehealth has been a slowly growing component of healthcare for a while. Many companies active in the healthcare space have sort of been trying to transition to more digital engagement, as well as to a more holistic approach to marketing beyond the products for quite a bit. But what we've seen is that this new approach to marketing was something many companies were struggling with to get right. Obviously, the pandemic has just been sort of this catalyst and this whole move towards digital, really putting digital developments in a pressure cooker. Right? Specifically, this move to telehealth has led many companies to rethink or reprioritize that digital strategy. So, knowing the effects of telehealth on the patient experience is going to be a key ingredient to building a successful digital strategy.
So, Yannicka, let's dive into the research. What insights were you guys looking to uncover?
There were so many questions that our clients were asking us, but we got to narrowing it down to just a few key questions to understand patient needs and expectations in a telehealth setting. The first thing we looked at was like, what was the magnitude of the shift from traditional to distant care as hospitals were harder to access for patients? The second thing we wanted to know was what was the patient satisfaction with telehealth and how willing were they to continue using telehealth? Third thing was that we also wanted to understand, how do patients assess the quality of their care through distant care? And lastly, we wanted to know what channels are patients using, have they used for telehealth, and what are the preferred channels to use for telehealth?
To really get this initial understanding, as Yannicka described, we ran a study among patients in the United States, so different markets, including France, Germany, Italy, Spain, United Kingdom, the Netherlands, and across a variety of different indications.
So, what did you guys learn?
Honestly, the findings really surprised us because going in, I personally thought that patients would really not like the shift to more distant care at all. But when we first looked at this data, we saw that patients were actually pretty positive about the shift to telehealth. 79%, so 4/5, that they had a positive experience using more distance channels for their healthcare. So that was a lot different than I was expecting. What was really helping this positive experience was that patients felt that distant care was less time intensive. They felt that they could more easily and more quickly reach their healthcare professional. And quite a big portion saw loss of impact on their budget as a result of telehealth.
Hmm. So you were surprised. It was a positive experience for most.
Yeah, so on the surface it was, but then we started digging a little deeper and we found that patients actually weren't so happy about the development. So we also asked them how likely they were to continue using telehealth to this extent in the future. And there, more than half indicated that they actually wouldn't be happy about using telehealth to this extent.
I'm going to add a little bit to that. So, what we found is that there were quite some negative components for telehealth patients. Some of the key findings we found was that 3/4 found that telehealth was sort of less personal, More than half doubt that the on the HCP end that they would have the ability to determine really what their physical health would be through telehealth. About a third feel their mental health needs to have more attention. They need that this sort of human touch in the consultations. 37% felt that they just need to have more regular consultations, and about 38% were concerned what are the standards, what is going to be the protocol for maintaining patient and provider confidentiality. So we also saw that proactive search behavior from patients was up. So half of all patients indicated spending more time looking for information about their health. But this is sort of a backdrop as to some of the key challenges that patients are identifying.
So that's quite a different story. Patients had a positive experience, but they also have concerns with telehealth. So what does that mean for our clients, for pharma companies? What are the implications there?
That's a good point. I mean, if we look at it from the patient side, it means that pharma companies can step in to help assure that patients feel confident and comfortable in those virtual consultations. There's an opportunity here. Both their physical and emotional needs need to be shared to ensure optimal consultation outcomes. And patients currently feel that telehealth isn't fully covering those. And the fact that they're spending more time and effort looking for information about their health just goes to show that patients are not confident right now, and don't feel fully in charge of their health. It's also worth asking yourself in this sort of disrupted patient journey. What does my patient population need in order to confidently share their disease and treatment needs with their healthcare provider to ensure that they get the best possible treatment outcome? And also, what kind of information do my patients need right now? More or less to feel in charge of their own health.
So really looking at it from the patient's perspective,
Yeah.
what are their needs? How can I help? But from the healthcare professional side, from their perspective, what's the role that pharma can play there?
Yeah, I think for healthcare professionals, this period has just been an incredible struggle. The shift in their way of working in what is such a precarious time for so many patients can take quite a toll. And I think that we can only really applaud how hard healthcare professionals have been working to continue care as much as possible. But setting up a digital care path in such a short amount of time has been very challenging, and the patient experience really shows it that this really is not optimal yet. This provides a really good opportunity for pharma to step in and help out. So it's worthwhile to consider investigating what it is that your target healthcare professionals need in terms of training, in terms of tools and information to feel empowered to provide quality care for patients through virtual consultations.
Thanks, Yannicka and Johan. We've just scratched the surface with the research today in this short conversation. You can download the full report here. And as we mentioned earlier, the team looked at 4 indication areas across 7 markets. So if you're interested in a deeper dive, just feel free to reach out. Thank you.